What is the most important thing when it comes to your health if you're a man? Is it the amount of muscle you got? Is it the amount of money you got in your bank? Or is it the amount of internal health you got? And the most important hormone that we have as men is testosterone. And today I'm here at Game Day Health in Woodbridge, Ontario, and I'm going to be meeting with the crew, the clinicians here to check my blood, see what my testosterone's like, and see what my internal health is like. Let's go. Fellows, Coach D here. When was the last time you checked what's happening under your hood? I'm talking about when was the last time you checked out your true health markers, your internal health, your blood markers, most importantly, testosterone, which is something that declines very quickly at 1% to 2% after the age of 30. And I'm here to check out my markers to see where I'm at, to see if I need any help, and to make sure that I have a good understanding of what's happening inside my body and not just focusing on outside. Stay tuned so you can learn more about my experience here and how amazing the staff are. All right, I'm going to start my blood draw, but before I go in, I'm going to grab a treat. I'm going to get some water. You guys have a really nice place. Let's go check it out. Hello.
I'm Jamie.
Awesome.
Nice to meet you.
Pleasure to meet you.
Come in, take a seat. All right, so I'm going to start off by taking a quick medical history. And then once you see me, you're going to go in and see our nurse practitioner, Tanya. And have you ever gotten your hormone panel tested?
No.
Okay, so we're going to do that today for you.
What do you check? What type of hormones?
So we check your testosterone levels, we check your PSA, your SHBG, your hemoglobin, hematocrit. We kind of do a full comprehensive
Nice.
blood panel. So I'm going to take 3 bottles. One of them is for your PSA and your SHBGs,
Okay.
and then the other one is for all the other things like your hemoglobin, hematocrit.
I'm not a
testosterone.
needle guy, so I'm going to be nervous. So this will be done every month, how often? 6 weeks, 4 weeks?
So we do your initial right now, and then once your levels come back and you sit with our clinician and you start your therapy, we do it at the 6-week mark, 3 months, and then 6 months again. And then in between, if you feel any symptoms, you come right back and we do blood draw at that point again.
Okay.
Okay?
What was cool is when I did the assessment, there was a bunch of questions going from mental, physical to sexual performance. And for people who have high levels, if it's something that you don't need, they're not going to suggest you get it. And if there's anything like a peptide that you need or just...
You get a poke.
Yep. If your numbers are fine, at least you know. But not knowing is the problem. And in today's society, we're in 2025, man. If you're not taking care of your body and you're not checking your blood and looking at your markers and your body fat percentage and measuring your waist and checking out your Planck test, man, you're letting your body just sap away. And for all the men watching here, you have a responsibility, guys. There's no excuse. You must take care of your health. You must draw blood and see where you're at. You must work out. Not if you got time. There you go.
All done.
What's next?
Now we're going to spin this blood.
Let's go spin it. Let's show you how they do it.
We're going to spin it on a centrifuge.
What are we doing now?
All right, so we're gonna have your blood sit here for 30 minutes, anywhere between 30 to 2 hours, no
So
longer
that.
than that. We're gonna
Nice
have
and
it
dark.
thicken up there just so we can spin it in the centrifuge.
So that right away thickened up. It looks like, in a matter of minutes. Wow.
Yeah,
You said for this to actually be proper for use, you can have a maximum of 2 hours out.
yes, but no longer than that. We'd have to spin it right at the 2 hour mark there.
Okay.
All right, and when it's spun, it's gonna look something like this.
Mm-hmm.
So that little bottom part here, that serum, is gonna help mix it in, and it's gonna separate the plasma from the buffy coat from the blood. So this is our centrifuge.
Okay.
We're gonna spin this here. So for Dynacare, our settings are 1200 RCF for speed, no longer than 10 minutes, and we'll spin it here. We'll put it in the fridge afterwards.
Awesome. And this just gives it a high volume of spinning, vibration. Is that how it works?
Exactly. It's just gonna mix everything in together for the serum here.
Okay.
If it's faster than that, normally sometimes it can damage
Right.
the red blood cell particles, and
Okay.
then the testing could be
Off.
out of the
Yeah.
range exactly. So we're
Okay.
gonna keep it exactly how they want it.
And then what's the next step? How long do I wait to get the results?
It shouldn't be more than 3 to 4 days, but I believe since today is Wednesday, we can have you in on Friday.
Yeah, generally it comes back in 2 days.
Okay.
So we have you come back in, see our nurse practitioner. From there, she'll go over your blood results in detail, and then you guys go from there.
All right, what's the next step?
All right, let's go ahead and book your next appointment.
All right, let's do
All
it.
right.
So this has been great, man. I really appreciate the opportunity.
Absolutely, Dimitri.
And I think it's great that we did this to kind of give an eye-opener to people to kind of understand where they are in their health and fitness.
So let's get you in here for Friday. We've got a jam-packed schedule here on Friday. Can we see you at 3:45?
I can make that happen.
Yeah.
I can make that happen.
Let's do it. Let's do it.
All right. Pleasure meeting you, bro.
Absolute pleasure.
Pleasure meeting you. And I'll see you guys on Friday.
Perfect. You're all booked in. I'll send you a reminder next.
What's up, everybody? Coach D here. And 2 days ago, I went and got my blood work checked out. I'm going back to Game Day Men's Health in Woodbridge, and they're going to give me my stats. They're going to tell me where I'm at. They're going to tell me, you know, what my testosterone levels are like, and a bunch of other tests. So I'm going to go check it out. Tiny bit nervous, just because as every guy, you want to make sure that, you know, you're strong and macho and your testosterone level's high. But at the end of the day, I don't really care. Whatever the number comes out to be, it's going to be. Check with you guys in a second, and we should be there in about 10 minutes. Peace. Tanya, thanks so much.
Hey, Dimitri, welcome to Game Day.
Got it.
It's nice to see you again.
So give me a breakdown. What are we doing today? We took my blood a few days ago.
Right. Yeah.
We put it in the centrifuge. We spun it around.
Right. So today is going to be more focused on your results. So
Awesome.
we kind of go over your results, think about, you know, what types of options would be there for you,
Okay.
and what you qualify for as a patient.
Awesome.
So you have to consider the candidacy. So some patients can be like testosterone replacement patients, and some will not qualify. So we have other options for them as well.
So what did you guys check for today? Obviously, we care about my numbers, testosterone. But what do you guys usually check for?
So we do a comprehensive blood panel. So we're kind of looking at, you know, blood sugar, your kidney function, liver function, making sure all of that is good, your electrolytes. We also just make sure that your testosterone, we check your testosterone, your sex hormones,
Gotcha.
and we check your prostate. It's a huge panel. It's an opportunity to learn about yourself and teach you about the options that we have. And then just overall, yeah, like how can we increase your performance in all aspects of life, and then how do we maintain that quality of life for the next 30, 40 years of your life?
Let's do it.
Mhm.
All right, so let's check on mine. What did you find out about my markers? And we're ready to tell it.
Yeah, so in terms of your testosterone level, there's total testosterone
Okay.
that we checked, and that's 26.3. So you're actually above our cutoff.
All right.
So
What's the range in case someone watching has no clue?
yeah, so in Ontario, it's 7.6 to 31.
I feel stronger than I've ever felt. I'm at 11% body fat. I'm 47 years old. So from an external point of view, I feel super great. But my doctor even said that there are cases where externally you can look great, feel strong, but still have low testosterone.
Absolutely. So yeah, as we talked about, so there's differences between like total testosterone and free testosterone.
Okay.
Total is more like, okay, what's the amount of testosterone you have in the body, but then how much of it is bound to proteins
Got it.
and how much of it is free. So free testosterone will give us a more accurate reading of, you know, how active the testosterone level is.
Mhm.
If you're under 600, we tend to also treat that. So let's say you have a high total testosterone, but your free testosterone is low and you're still symptomatic, then we can justify the treatment there.
Just because some of you guys may be thinking it's only for testosterone, that's one thing that they can specialize in, but there's more markers to check through.
Right, and if we do find something outside of our scope, we do suggest to go back to your family doctor. Again, for the example of the thyroid, we would then get you to be treated by your physician.
Okay.
And then we work together to get you optimized.
So let's say right now, if my numbers were lower, I'd be a candidate for testosterone.
Right.
If someone wants to do testosterone, what's the different forms of them? I know that there's intramuscular needle injection.
Mm-hmm.
Okay, that's one form. That's the old school way.
Yeah.
Is there any other forms that you guys would have?
Yeah. So for those people who don't tend to like, in weekly injections, so that's what it would be. You
Okay.
would come in every week, or we would teach you how to inject, and you do it yourself at home.
Okay.
So that's an option there. But for those who, let's say, travel like a lot, or if you're a truck driver who, is constantly on the road and you got to cross the border, and some patients don't feel comfortable with the needles and all that. So we would suggest something called pellets. And pellets are, it's a small procedure where you would come in the clinic, it's 15 minutes. We would numb you, we make a small incision, maybe about 4 millimeters big, and then I insert these pellets, which kind of look like little suppositories, and that just slowly releases the testosterone.
Oh wow, that's interesting.
Yeah, so it's more of like a consistent.
Is that better than the cream versions or oral?
So cream, we don't even offer here because it's helpful, but it's not going to get you to the optimal.
Right.
And it's very slow to progress.
How about taking testosterone pills? Any difference? I know it'll go for the liver and all that, but is it the same potency as the pellets?
So testosterone pills don't actually exist in Canada. There is American version, or like there is a version of oral form, but it's American based. We're trying to get it into Canada, of course, and it actually bypasses the liver. It'll be taken up by your lymph nodes. So it's actually showing really good signs, reduced side effects, but again, it's not Health Canada approved yet, so we don't have it in here in our in the game day protocols.
Interestingly enough, I remember when I spoke to one of the owners here, if you could tell the people watching, age category, what is the starting age category you've seen people come in here and then?
I've seen as young as 22.
22, that's crazy.
Maybe they're just interested in knowing their testosterone levels, but surprisingly they're quite low.
There's a problem.
Yeah, it's quite low. And fun fact, the middle-aged man is no longer like 50, it's 37.
Wow.
Just because of the plastics in our environment, the types of food that we eat.
Stress levels, inactivity, being on your phone all day. But I think most importantly, and why we're here today is to give education, to remind people that it's not going to cost you anything to come in here and learn and sit down with you guys to hear.
Right.
I like how you guys are more goal-driven in terms of what's the goal of the patient, what are the symptoms, what are they looking for.
Right.
A lot of times people hear TRT and all they think about is you want to get big and muscular. But it's also based on erectile dysfunction, which I do know many men who I speak to who have great jobs, great careers, great finances, great assets, but they're struggling in that one area.
Right. And that's the thing, it's like, don't suffer in silence. We want you to come in, we want you to be open and talk about these things because it is normal. There's nothing I haven't heard. So in terms of that, it's not, it's very normal in a men's health area to speak about this. It's not something to be worried about. I
always tell people this, you need to look at lifestyle, you need to look at nutrition, you need to feel like your mindset in terms of how you feel, and then you have supplementation. So it's not just boom, go to the first one here.
Yeah, so again, in combination with things, like I always tell people, I'm not just going to inject you with testosterone and magically you're going to become better.
Right.
It's all about, again, proper nutrition, proper hydration, proper supplementation. So taking your omega fish oils, that's very important on testosterone therapy. And just overall like exercise, because that's what's going to be great for you.
You heard that right, guys? Exercise.
Yeah. So testosterone will provide that energy that you're lacking to not go to the gym, the motivation that's lacking to not go to the gym, right? So once you kind of have a few weeks of the shots, I would say by the 5th or 6th week, you'll start to feel something. And if you don't, that's okay too. It's just a matter of like finding a proper dosage for you. And then, it's just a matter of time that we will find a good balance and you kind of will gain that energy and then you'll go to the gym and then you'll start to see results and that's the benefit.
So it's nice. You guys have a few different principles. I'm really interested in the peptides because again, if you are getting checked out and you want to find out where your numbers are, it doesn't have to be just one therapy. It can be a mixture or it can be just coming, getting checked out, learning, educating yourself, going back home, changing your lifestyle, changing nutrition, getting involved in training, building yourself up. And then if you come back for another checkup and you're still off, then you can know that something is off, you need to make some changes.
Or look at the guy who's, able to be there for his family by waking up and having the energy to go for a walk or do things, right? That's the idea. It's not just about, I'm going to get jacked. It's about, brain, physical, and sexual health. And that's how I kind of put it simply.
Awesome.
Yeah.
Well, thank you so much for your
Yeah, no
time. It was
problem.
amazing coming
Yeah,
here.
it's nice.
All right, guys, you got the full episode. You got the insider look. And obviously, there's nothing that I'm hiding here. Some people were saying to me, are you really for real going to make this video and you're going to tell the world what your numbers are at? I don't care. The fact that I wanted to make sure I can understand where I am from an internal level is why I came here today, which is why we're doing a joint partnership, training and internal testing with this company to make sure that people are educated. You see, information is important, but education is more important because you can actually think about what you want to do here, and then you make a second plan to come in, discuss it with your spouse, and set up a strategy. So the one thing I want to leave with you guys is whatever the number is, doesn't matter because you obviously are going to be able to make the changes in your lifestyle through lifestyle habits and through supplementation. And the one thing that is going to be a non-negotiable is even if you decide to work with this team and get assistance with proper hormonal therapy, and I'm sure you guys would agree, training and nutrition are going to be a base, and then supplementation is going to help out.
Absolutely.
It's just like taking medicine for, anything you take. We got to make sure your body's strong. And that's where we're going to come in to assist you guys, whether you want to come to Vaughan at our fitness studio, Pure Motivation Fitness, whether you live outside the city, you're like, you know what, I'm working with these guys, but I wouldn't mind doing your online training program. We can assist you. And most importantly is the data that they're going to give you, because they gave me really good data today, and the data that we're going to provide from a body composition standpoint, from a MyZone heart rate monitor standpoint, from checking out your macros every week to your workout efficiency, the percentage of your training. When you tie that in together, you'll see changes.
We got your labs printed out. They're right here.
Boom, boom.
Take your time. Make your decision. All the information is there for you.
Yeah, man. I'll book an appointment for next Wednesday to come back and check you guys out.
Absolutely. We'll book you in.
For anyone who's interested in messaging or reaching out to these guys, just mention Pure Motivation Fitness. They will take care of you and give you extra assistance. And remember, at the end of the day, average is the enemy. Action beats anxiety, and your attitude is everything. Peace out, and we'll see you in the next video.